Welcome to today's presentation, How to Check and Optimize Your Metabolic Health, lab work that every single person should know. This might be the most important lecture in your life, and here's why. What is one thing that every single person has, but barely anyone understands how it works? That is the human body. The human body is the most sophisticated piece of technology ever created. And many of us do not have a blueprint, a roadmap, or a guide on how to make sure that it's functioning at a high level. So, just like you take your car in for maintenance, we need to make sure that we're doing the same thing for our body so that way we get as many miles out of this prized possession as we can. So, let's begin. Today's agenda is all about risk reduction. We want to give ourselves a chance to be here for a long and good time. Okay, we're going to be defining metabolic health. We're going to talk about insulin resistance and chronic disease. And this is super important, so make sure you pay attention. And then we're going to be talking about lab warning signs and optimal targets, not reference ranges, optimal targets. We want you to perform at a high level, and this is how we do it. Then we're going to talk about steps to supercharge your health. But first, let me introduce myself. My name is Dr. Jufo, known by Dr. Blade on social media. That's a story for another day. And I'm a physical medicine and rehab doctor, and I've also been a fitness coach for the better part of a decade. And my passion really lies in helping people with their wellness journey by empowering them with science-based information, so that way they can optimize their health, perform at a high level, and be there for the ones that they care about. Because I've seen too many people that have gotten too sick or have left this planet a little too soon, all because of things that were preventable. And I've seen the families destroyed. I've seen the mental toll it takes on the care providers. And I realized that helping people at the end stage when they're in crisis is not good enough. We need to do things earlier on to prevent these rapidly deteriorating consequences that we're seeing, such as strokes, the heart attacks, the amputations of limbs due to diabetes, and the chronic kidney failure. We need to do something earlier. And that is why I do what I do. Right? A lot of people ask me, how are you doing this when you're a doctor in residency? Why are you training all these people? Why are you being a health coach? Because it's important. Because what we are doing right now in medicine is not enough. Okay? And if you're a doctor watching this, you know it's not enough. You know our system is not set up for us to be successful at what we're doing. Right? You know there's something more that can be done. That's what drives me. So first, let's define metabolic health. What is that? There's no official definition of the term metabolic health, but at Blade Fitness, my company, we have observed that a large part of being metabolically healthy means being able to digest and absorb nutrients from the food that you eat without unhealthy spikes in your blood sugar, your triglycerides, and without inflammation and massive rises in insulin. And, it's important to avoid these big spikes because they will and can contribute to long-term consequences to your health, such as leading to high cholesterol, high levels of body fat, a large waist circumference, and elevated blood pressure. And all of these things are linked to what we call the 4 horsemen of chronic disease that are responsible for the majority of death and disability in adults. That is diabetes, cancer, dementia, and cardiovascular disease, aka strokes and heart attacks. So having a good metabolic health lowers your risk of getting all of these diseases. And this is not a fat shaming seminar, right? Because body size does not tell the full story. There are so many people that are listed as normal weight that still have many of these issues, such as high blood sugar, the high blood pressure, the low HDL cholesterol, and high triglycerides. So this is not a body size issue. And in fact, there was a study done from 2009 to 2016. These researchers out of North Carolina, using the most recent guidelines for metabolic health, came to the conclusion that only 12.2% of adults in the United States are metabolically healthy. Yikes, right? So it's pretty safe to say that 88% of the United States is not obese, so it's not an obese thing. In order to qualify as being metabolically healthy, you had to make sure that you didn't have any of these risk factors listed on the screen. So your waist circumference had to be under 40 inches for a man, under 35 inches for a woman. You had to make sure your triglycerides were less than 150. Your HDL cholesterol had to be above 40 for a man, 50 for a woman. Your blood pressure had to be under 130 over 85. And your fasting glucose had to be less than 110. So they did the study. There was only 12.2% of adults that met all of these criteria. And this is why. Because not everyone can get obese. This comes down to the personal fat threshold. Some people just have an ability to form way more subcutaneous fat than others. All right. And whenever you hit your personal fat threshold, now your body's going to start packing fat into places it shouldn't be. And instead of it going to your hips and your buns and your thighs, it's going to go around your liver, around your visceral area, around your heart. These are places that you do not want visceral fat. And we can look at a patient like this. This is an individual that has lipodystrophy. So he has an absence of adipose tissue. So he does not have really much fatty tissue at all. He almost borderline looks like a bodybuilder. Look at these biceps, right? But meanwhile, he is suffering from end-stage diabetic complications because all his fat is stored in his visceral area. He's not able to store fat in his thighs, his hips, his shoulders, his back. It's all inside his viscera. And unfortunately, because of it, he died at an early age of 39. This is not an obesity issue. Obesity is a consequence of the metabolic issue. And the only way that we figure that out is by looking under the hood. And that means looking at your lab work. So that's what we're going to do today. And we need to understand that when we're looking at these labs, reference ranges are not great, right? They don't provide any information on what is optimal. And sometimes they don't even take into account research on the risk of developing certain diseases. And a lot of these things are telling a story. So you can't look at things in isolation. I know so many people that they said, oh, I went to my doctor. My doctor said my labs are fine, and that then they feel like, okay, I'm not going to change anything, versus looking at the labs critically and being like, okay, this is trending upwards. This is something that we probably need to reduce. This is ways that we can improve, because those reference ranges that we have a lot of times are based on a population. And if the population is not healthy, neither are the reference ranges. And that's why I never tell my patients that their labs are fine, because they fall into the reference range. And I really believe this strongly, that every patient should understand their own labs. You've been to the doctor enough that you should understand these labs, but your doctor's probably not explaining them to you. So that's what this video is for. It's your body. It's not your doctor's body. It's your body. And you should also have a sense of optimal ranges for each test. And you should understand how all of these things interact with each other. So what I want you to do is go get out your most recent lab results, grab a pen, and let's go through it together. We're going to primarily be looking at metabolic markers. So that's pretty much your lipid panel, insulin, and stuff like that. So the first thing that we're going to talk about is LDL cholesterol, the scapegoat of heart disease. So what does LDL cholesterol do? What does it mean? So when you look at LDL cholesterol on its own, it doesn't actually tell us that much unless it's at very, very high levels. And what matters more is what type of LDL particles that we have. And specifically, it's the ratio of the small, dense LDL particles, because that is the particle that's going to end up being able to be embedded inside the wall of your arteries and cause problems. But it's really hard to test for this. You need a test called like an NMR lipoprofile test. And most doctors don't run that. So a lot of times we just see your LDLs. If we say your LDLs are high, we just assume, right, we need to adjust that and then we'll put you on a statin. But that's not the best thing to do necessarily, because it's not telling the full story, right? So another way for us to get a sense of our risk of getting this type of deposition is you can look at your triglyceride to HDL ratio. And that's going to be covered in the upcoming slides. And that is not to say that LDL is not dangerous. Oxidized LDL is involved in the plaque buildup in the walls of the arteries, and in the context of glucose dysregulation, which is insulin resistance, prediabetes, diabetes, and inflammation. So the elevation of the LDL could be a strong risk factor for strokes and heart attacks. So if you are damaged, if you are compromised inside of your bloodstream, that's when LDLs, specifically the small dense LDL particles, are the most dangerous, right? And that's when they're the most abundant as well. So That's what we need to really be focusing on, and that's what we're going to focus. So just so we can drive this whole LDL cholesterol thing home, let's look at the study of 130 plus thousand patients in UCLA. It was a 5-year study. What we see is that in the results of the study, 75% of heart attack patients had the LDL less than 130. So this was 75% of the population. Right? And we saw that over 50% had an LDL less than 100. Right? In fact, the most heart attacks were actually at 100. And, as the number went up, they kind of went down. So there's not really a very direct correlation between high LDLs and heart attacks. In fact, it almost looks like it's the opposite, right? And I'm not going to say it's the opposite, but I'm just saying this data is not very compelling, as you can see, as LDL being the only thing we need to look at. And it's because of some of the things I mentioned. So there was another study that was done, the Framingham Heart Study. And one of the takeaways from this study was that if you had very high LDLs, you're more likely to suffer a heart attack. But when the data were analyzed, unless the LDL was over 200, it wasn't really a very good risk factor to look at. So they did notice, however, that if you had LDLs less than 70 in general, then there was relatively little heart disease. And for the rest of the population, the LDL was not a really good predictor. More people are actually suffering heart attacks at a lower LDLs than before, because the standard test that we use assumes all the LDL particles are the same. And like we mentioned, they're not. It's the small dense ones that you're looking for. But what we do see is, like, on the right-hand side over here, this is the HDL cholesterol. And the HDL cholesterol is decreasing over here, and the LDL cholesterol is increasing over here. So say we have HDL cholesterol at 85. Even at high levels of LDLs, the risk seemed very minimal. Now, if we bring the HDL number down to 25, that's the highest risk, right? So it's the highest risk across the board, regardless of the LDL number. These are the highest risk. So you do not want low HDLs in the setting of a high LDL in general. But that just shows your HDL is actually playing a huge role as well. And we're going to talk more about that shortly. So what is the summary? The summary is that the LDL measurement can be quite misleading. And what is more important than just looking at your LDLs is understanding the amount of small dense LDL particles and the high dense LDL particles. And it's also important to look at the triglyceride and triglyceride HDL ratio, which can give us an insight into our cardiovascular health and risk. Now, we still want to keep these levels within an optimal range. So what is optimal? Optimal is, for some, less than 100, but some would argue less than 70 is better. So regardless of whatever you feel like, you got to look at this in the context of your triglyceride to HDL ratio, because this ratio is a helpful biomarker for the risk of heart attacks and strokes, and also the presence of insulin resistance. So that's where we're going to next. So what is more important than the LDL cholesterol? Well, many would argue it's the triglyceride to HDL ratio. This ratio has been shown to be the strongest association with cardiovascular disease than any other lipid marker or ratio. And if you want to do some more research, there's a study here that says elevated triglycerides to high density lipoprotein cholesterol ratio predicts long-term mortality in high-risk patients. And there's a plethora of studies that show the same thing. As you can see on this graph here, we have on the left-hand side, LDLs less than 140, LDLs over 140. If you look at the rate of heart disease in this specific study, it wasn't really that much different. So it's 13%, 14%. However, when you looked at the low triglyceride to HDL ratio versus the high, which is an indicator of insulin resistance, the risk doubled, right? So that's why this is a great predictor. It's something that everyone has whenever they get a lipid panel, so it's easy to calculate. So in summary, many experts agree that this ratio is one of the best markers of insulin resistance and metabolic syndrome. If the ratio is over 2-to-1, that's a sign of metabolic syndrome. The lower it is better, right? So you want to try to aim for 1, 1.5 at the max, but you don't want to be over 2, right? If you're over 2, you're at higher risk. If you're over like 7, which I sometimes see, then you're really at high risk and you really need to make some changes. All right, now we're going to talk about triglycerides. What are they? So triglycerides are essentially a type of fat that your body can either use for energy or can store in the fat cells for later use. And the lipoproteins, which are the things we were talking about earlier, the LDLs, the HDLs, they transport triglycerides in the blood, packaged along with cholesterol. And triglycerides are more prevalent in remnant particles, such as the VLDLs, and they're less prevalent in LDLs and HDLs. And we see in studies that if you have high triglycerides, this is independently associated with increased risk of cardiovascular disease. Okay, so you definitely don't want these high. This is not like the LDLs where you can get away with it being high. If your triglycerides are high, this is problematic. Okay, and there are some medications that can lower triglycerides moderately, such as fibrates, taking fish oil and niacin. And here's another interesting thing. So even though, and this might be confusing, but even though your body can make triglycerides from dietary fat, often it makes it in order to store excess carbohydrates. In summary, triglycerides are a very important marker of metabolic syndrome and insulin resistance, and you definitely want them to be less than 150, but optimal is less than 100 or even 70. I prefer being under 70. Mine is about 55. All right, so now we're going to talk about insulin. Insulin is something that is known for its ability to regulate blood glucose in the blood, right? It allows the cells in the muscles, the fat, and the liver to absorb glucose that is floating around in your bloodstream. And the glucose serves as an energy to these cells or can be converted into fat when it's needed. And insulin also affects other metabolic processes such as the breakdown of fat or protein. And the thing with insulin is that too much of it causes insulin resistance, which is a very common phenomenon right now in society. And for every 1 microunit increase in the fasting blood insulin, a person can expect to experience an approximately 20% increase in insulin resistance. And this represents a fundamental feature of how the body works. When a process is excessively activated, the body's going to dampen its response to that excess stimulus in order to reduce the activation. Similar to like if you drink too much alcohol, you become very tolerant. And then you're like, oh, I have a high alcohol tolerance. Well, you're an alcoholic. But the same thing's kind of happening with insulin, right? If you eat in a way that's going to secrete a lot of insulin, you're going to get to the point where your body's just going to start ignoring the signals and you need more and more of it to accomplish the desired result. We even have studies of type 2 diabetes that have shown that consistently the addition of insulin to the treatment regimen or the intensification of insulin treatment results in a higher rate of cardiovascular events. Surprise. And for more on that research, you can look up this study right here, which is titled Insulin, Too Much of a Good Thing is Bad. So the wild thing about this whole insulin thing, and the reason why it intrigues me so much, is that you can have a scenario where a person is steadily becoming more and more insulin resistant, but the insulin is still working well enough to keep their blood sugar in a normal range. And this can develop over years or even decades. And because we only look at glucose as the problem, we don't recognize that there's an issue until the person is so insulin resistant that their insulin, no matter how much they produce, is no longer enough to keep their blood glucose in check. And it's at this point, possibly years after the problem started, that we finally notice the disease, aka prediabetes and type 2 diabetes. And this is why most people that have insulin resistance are undiagnosed. We don't look at it correctly. And then you can see over here in this little chart that there are a lot of things that contribute to insulin resistance, from inactivity, genetics, aging, medications, rare disorders, obesity. And the result is you have type 2 diabetes, PCOS, you have clogged arteries, dyslipidemia, hypertension. And to make matters worse, a lot of people have been blaming salt for why they have hypertension. But there's many studies that show that insulin resistance is the hinge between hypertension and type 2 diabetes, because insulin leads to a reabsorption of sodium, which ends up becoming the real problem that's leading to the hypertension. And why did you have high insulin? It's not the salt's fault. That is secondary to the sugar metabolism, right? So we're blaming salt for what the sugar did. So in summary, fasting insulin is an extremely important test because this fasting insulin rises long before fasting glucose does. So this is the warning sign that we need to be looking for. Now, what are the optimal levels of fasting insulin? Somewhere between 2 and 6. If it's over 10, I would be concerned and I would start making some changes. If you're over 15, you need to make a lot of changes. This is not good. All right, so now we're going to talk about the Homa-IR test. It's a very cool and simple test. The concept is very simple. How high does your insulin need to be to maintain your fasting glucose? So you can see over here, we have a couple charts. So this is a group, 2 individuals that have their glucose scores, and this is their insulin, and then this is their Homa-IR test. You essentially want as low as possible. So we see someone's blood sugar. Someone comes to the office, we check their blood sugar, it's 100, maybe a little concerned, it's a little high, right? But in order for them to get that 100, they only needed an insulin of 4. Now, you look at this person that had a glucose of 86, we're like, oh, this person's perfectly metabolically healthy. Meanwhile, they needed an insulin of 16 to get down to 86. So now their Homa-IR is 3.5, right? 4 wouldn't have done the job. If they only got an insulin of 4, this person's blood sugar would have been way higher than this 100. Okay, so that's why this test is so powerful, because it tests your glucose and insulin at the same time and sees the relationship between the two. So in summary, this is an indirect measure to indicate how your body's insulin is working in dealing with glucose, and it's going to identify insulin resistance. Now, what is optimal? Optimal is as close to 1 as possible. If it's over 2, that's early insulin resistance. If it's over 3, it's definitely significant insulin resistance. All right, so now we're going to talk about fasting blood sugar. What does it mean? So a fasting blood glucose level can help you identify problems with your carbohydrate metabolism. If it's too high, we need to start asking ourselves some questions. What is going on? So often, in about 10% of the population that has diabetes, they have type 1 diabetes. This is something that's typically found when they're under the age of 10, they have rapid weight loss, they're urinating, or they might have a crisis where their blood sugar is super elevated. So that's that autoimmune condition. And then you have another autoimmune condition that's a little later onset. That's called LADA. And then you have a non-autoimmune version of diabetes, which is called MODY. This is mature onset diabetes. And then you have type 2 diabetes, which is secondary to insulin resistance. Right. So these are all things that we can kind of learn from just looking at a fasting blood sugar and doing a deeper dive into what's going on. And this matters because if you have chronically high elevated levels of blood sugar, you're going to damage your blood vessels and your nerves. It's like you're rotting yourself from the inside out. So you don't want to just let it be high. So we want to look at what are the things that are impacting your blood sugar and how can we monitor it? How can we fix it? And some of those things include stress and sleep, diet, and exercise. So your fasting blood glucose is the easiest blood biomarker to track, and it's highly correlated with metabolic syndrome and other things like dementia, chronic diseases, and cardiovascular disease. So you definitely want to make sure that you're aware of your glucose metabolism. And it's very easy. You can get a glucometer. You can check your fasting glucose. You can check your 1 and 2 hour postprandial, so after eating glucose, and then that'll give you a good indication of how your body's functioning. Or you can get a continuous glucose monitor, which is something that I've done in the past. So when it comes to your fasting blood sugar, here are some optimal ranges. Optimally, you want it to be between 70 and 90. If it's 90 over 100, check it a couple times. That's a caution zone. If it's over 100 to 125, that's pre-diabetes. And then if it's over 125, then that's diabetes. So these are all ranges that we want to try to bring back down into the optimal levels. And I want to make a quick note. So if you're someone that has type 2 diabetes or you've been, pre-diabetic for a while, when you're trying to get back down to the 90 to 100 range, it's not going to be the easiest thing. You might start getting headaches. Your body needs to get used to the saturation of sugar that is appropriate for optimal health. So a lot of times I've seen people that are trying to get back down. They're like, oh, I don't ever let my blood sugar get under 120 because I start getting headaches. But that's not healthy. So working with your clinician to be able to get your sugar levels down to where you can tolerate it being within the normal range is very, very important, even if it might feel terrible at the beginning. Now we're going to talk about your hemoglobin A1C. This is a test that's essentially the measure of the percentage of a patient's hemoglobin that is coated in glucose. As you can see here, this is hemoglobin, and this is glycated hemoglobin. So essentially the glucose attaches to it, and that's what we're measuring. So this gives us an idea of the average blood sugar over the last 3 months, which is a really powerful measurement for us because like we looked at with the previous measurement, this fasting blood sugar, it's like a snapshot in time. So this is more so of an average. Right. So essentially, this is going to be a good indicator of your glucose metabolism as well over a time period. So when it comes to hemoglobin A1C, what is optimal is between 4.5% to 5.3%. When you start creeping up to like the 5.7%, so you're getting into the pre-diabetic range. And then when you get up to like the 6.3 and above, you're diabetic. So we want to keep those numbers down. Now we're going to go into the C-reactive protein. So what does it mean? This is a very important marker that a lot of people don't check, but you should, because here's why. This is a marker of inflammation, and measuring these values can help determine disease progress or the effectiveness of treatments. And it can be a good warning sign that your body is reacting to certain things like your diet, from gluten, refined carbs, or an infection or chronic inflammation. So this is a compound that's synthesized in the liver, and it's part of the body's immune complement system, which binds to dead or dying cells to help mark them for clearance by phagocytes. So high CRP levels are typically found in individuals with obesity, secondary to the fact that they have excess fat, which can be inflammatory. It's also found in individuals that have heart disease, type 2 diabetes, Alzheimer's disease, leaky gut, infection, cancer, and even people that have sleep disorders like obstructive sleep apnea and other states that essentially are chronically inflamed, because all of these states are linked to chronic inflammation. Okay, so that's why it's very important to check this, so that way you know what things you need to improve and work on. When it comes to an ideal and optimal level, less than 1 is ideal. Anything above that, we need to start doing an investigation into figuring what is going on inside that body. So here are all the optimal ranges for metabolic health, right? And I want you to remember, I am a doctor, but I'm not your doctor, right? So this is not medical advice. Even though this was like medical education, it's not medical advice. At the end of the day, you still should work with a clinician, work with a professional to try to come up with a plan and a strategy to make sure that you're living an optimal, healthy life that's not super dependent on medications, and that allows you to be there for the ones that you love and the ones you care about, because that's ultimately why I created this presentation and why I do what I do. Now, if you feel like, hey, you're too busy to figure out all this stuff on your own, and you would like an opportunity to train with someone that will give you a custom roadmap that understands your health risks, then I'm giving you that opportunity. I do offer a program that is designed to help you optimize your hormones, to help you burn unwanted body fat if that's your goal, that helps you build muscle, improve your energy, and most importantly, holds you accountable while optimizing your blood work. And I don't only train men, I train women as well. And the process works like this. So in order to apply to work with me, all you have to do is click the link down below this video and schedule a strategy session. And during this strategy session, we're going to go over your lab work one-on-one. You're going to receive a step-by-step body revitalization program. You're going to learn how to build a diet that you enjoy, that supports your goals. And you're going to learn how to train effectively and efficiently, so that way you get into the best shape of your life. Ultimately, health is wealth. We can't take our riches with us when we die, and our life on this planet is really going to be dictated by our metabolic health. So today is a day to start fresh, to eat right, to train hard, to live healthy, to be proud. So whatever you choose to do, just take action, right? You have the resources here. Look at your labs, make some positive changes before it's too late. All right. It's been a pleasure presenting this for you. Hopefully you found it informative. And like I said, if you're interested in applying to work with me, just click the link down below. There are limited spots, so you definitely want to do that as quick as possible. And then we can start the process and I'll reach out to you. All right. Take care.